Hello, everyone, and welcome to 7th IVF Summit and Award powered by IHW Council. I am your host, Kavita, for today's session. Today's session is about fertility care in India. Thank you so much, ma'am, for joining us. Ma'am, can you please introduce yourself?
Hi, Kavita. Good evening. I am Dr. Puneet Rana Arora, and I'm a gynecologist and a reproductive medicine specialist, at the moment practicing at CIFAR, Gurugram.
Okay, ma'am. Ma'am, what are the fertility trends in India that you have observed over the years?
What I see in my practice is that the incidence of infertility is increasing. The age group of women or couples who come to us for treatment is increasing. And also, I have seen the parameters like semen parameters in the male partner are also decreasing with time. So there's a lot of shift towards, I would say, infertility. Number of infertility patients we see, the age at which we see them, that's kind of increasing.
So couples now face different factors that is the reason for their infertility. So what is something that has changed with the years? What are the factors that has contributed more towards the infertility rates?
So I would say when we trained, like, 30 odd years back, there used to be a lot of incidents of infections. So we would see blocked fallopian tubes more in incidents. Whereas now, what we see because of the delay in having a child, and especially women who are born with set number of eggs and oocytes, their AMH is seen to decline with age. So if we see a patients who have less ovarian reserve or egg reserve, or maybe the lifestyle pattern like stress at work, the inadequate sleep in the night is affecting egg parameters and sperm parameters. So the infection is now not that much common cause, whereas the ovarian reserve and semen parameters have become a major cause in these DNA.
So what have you seen the trend that in tier 1 and tier 2 cities that they are more prone to fertility clinics and they are more acceptance of fertility clinic going there and freezing their egg. Are they more open and receptive against it?
You mean to say tier twos and
Tier
clinic?
1 and tier 2 cities.
So I would say that thanks to as platforms like this, the awareness is definitely increasing, and people are coming forward for preserving their fertility, what we call as fertility preservation, in case they're not planning a pregnancy in the near future. So the difference in tier one and tier two is the tier two cities. At one point at one end they are freezing, and at the other end they're coming forward and having the treatment, right? So again, it is an extreme from preserving to utilization of the gametes. So I would say the preservation has become more prevalent now than before.
So, in the near future, what are the challenges that the challenges that we're facing right now? It will be improved, and we'll be in a better shape and better healthcare fraternity.
Yes, so I think prevention, I think, is the way forward, because we know that women is born with set number of eggs and that decline with age. So if the eggs are preserved at the right age when they are healthy and good in number, that is going to give us adequate outcomes. Same with sperm parameters. The sperm parameters, if we feel that the lifestyle is inadequate and it's declining, preserving at the right time will improve the outcomes. So I think preventive strategy of preservation of eggs and sperms is definitely going to help optimize the fertility in the future.
So, what are some myths that you've seen that still is there in the industry that you'd want people to speak much about the healthcare leaders, the experts, the clinicians that should be the that should be out there for people to understand?
So I think there are certain myths, because when we practice, we see that sometimes people come very late for treatment. So if a couple has not been able to achieve pregnancy in one, maximum 2 years, they should seek help. Somehow they keep on taking alternative therapies. They feel they will get pregnant, because we know that after 2 years of trying, the chances of pregnancy become very low on its own. Help is needed. So it's better to come at the right time, get the treatment, and get an adequate outcome. The other myth which we often have is patients often ask, okay, if I opt for IVF, is it going to be 100%? It is not. It is science. So everybody is an individual. Everybody have their own success rates. So we cannot generalize it to 100% success rate. The other myth we also kind of get from the patients is my IVF child going to be different from what if I conceive naturally? Again, that's not true. It is same. It is only the science is being used to make that embryo and the fetus. So these myths are there, but I think a lot of clarity is happening now. People are getting educated, they're getting better in this understanding.
At what point people should seek professional help, and they should start their journey of IVF, or in case fertility test that a couple should start taking after, just after marriage or after 2 years, if they want to get into the journey of IVF or fertility?
So, if we go by definition, it is after 1 year of trying, like religiously trying nicely. But also, an important parameter to keep in mind is the female partner age. If a woman is less than 30, 33 years of age, 1 year, 2 year is fine. But if a woman crosses the age of 33, 35, even 6 months is enough to give a pregnancy. And I think she seek help if it is more than 6 months of trying. Once a woman crosses 40 years, I think you should just wait maybe 3 or 4 months to seek help, because it's not like that you'll be advised IVF all the time, but at least a guidance can be given how to improve the outcomes even naturally. So I would say the women age is an important parameter which should be kept in mind when a couple seeks fertility help.
So, personalized treatment is what we are seeing a lot in this generation, because of a lot of factors, a lot of things like a lot of factors like smoking, drinking, and air pollution, other disruptors that is in the environment. So, what do you feel is something that people should always understand in terms of personalized treatment?
Yeah, so I would, this is a very good question. And I think it's a very important counseling point to our patients, to our couples who walk in. Everybody have their own has their own probability. A couple might have a probability of 30%, 40%, 60% of outcome, and these are dependent on various factors. How is the sperm parameter? How is the egg quality? How is the uterine architecture? How is the endometrium? So what we do in our clinic is we give every couple a very, very individualized success rate once they have been thoroughly assessed, because the protocols, the management for each patient is different. It is not a blanket treatment. We cannot offer what we have offered to one patient, same as the other patient. And that's why our success rate is better.
So, what is the fertility care in India changed, um, and what changes will be brought in the near future?
So the fertility care has changed from counseling to advanced technologies. I think we all understand that this can be a mentally exhausting situation for a couple when it is not successful. When, despite using those technologies, if a couple doesn't get a pregnancy, it is very mentally taxing to the patient. So our counselings have advanced. We talk more to our patients. We have involved dedicated psychological counselors in our clinics to help patients navigate through this journey in a more stress free environment. So that is the initial bit. But when they cross this journey and use the advanced technologies, even in the advanced technologies we have labs which are covered with three kinds of filters, because it is the embryo, it's a new life which is being formed in the lab. So the filters are, we have proper accreditations, quality control systems. And in case they're not successful with these routine procedures like IVF, ICSI, we have advanced procedures like using Zymote or Pixie for sperm selection, or using genetic analysis for embryo, or using ERA for uterus assessment. So there are a lot of advanced technologies which are coming, which helps to counsel our patients in case they are getting repeated failures. But this also helps to reduce the time to pregnancy. We rarely see these days now patients or couples with 10 failures, because after one or two failures, we start intervening with these advanced technologies which help them to achieve pregnancy at the right time.
So, it's really important to understand the root cause. Really important to get into more integrities of the problems, then get the treatment accessible. That is accessible. IVF centers are around the world, like it's more increasing day by day, but the right consultation to the right clinician, consultation to the right uh, cause of the problem is what we are focusing more on. So, with the advancement, do you feel that there's some blockage or problems that still need to be addressed?
I think the blockage main I feel is a financial barrier, because if a couple ends up having more cycles, in case, like I said, everybody's an individual. So, or advanced technologies which come at a cost. So, I think that's where maybe insurance companies or government can help to streamline this. Maybe like in Western world, government offers one cycle maybe free of cost, right? So, or maybe two cycles free of cost. So, I think financial barrier is the main thing. I think we are very up in our technology, we are very up in our science, but this is what the biggest barrier I feel right now it is.
Thank you so much, ma'am. It was great talking to you.
Thank you.